day everyone, I'm Shahara Reyes from BSN 12D and I'm going to perform a female urinary catheterization return demonstration. This is the insertion of a flexible tube through the urethra into the bladder to empty the urine. Also reduces the risk of infection and kidney damage by making sure that the bladder is empty. Now it's checked for the doctor's order for catheterization to ensure that I have the right patient and right procedure to be done. And I have also performed hand washing to reduce microorganisms that causes disease and contamination. And I also prepared the necessary equipment to be used. This is to conserve time and energy. Okay, so good morning, ma'am. My name is Shahara, a student nurse in Davao Doctors College. And may I see your wristband, ma'am? And please state your complete name and your birthday. Okay, and what do you want me to call you, ma'am? Okay, Ma'am Eliza. So since you're having a difficulty in urinating, your physician, Dr. Chavez, just ordered that you'll be having a urinary catheterization, urinary catheter, which means I am going to expose your private area because I'm going to insert a tube in your urethra so that you can empty your bladder and you can empty your bladder completely. And do you have questions or clarifications, ma'am? Okay, so as you can observe, ma'am, I'm now done for providing you a privacy by closing the door and the curtains to maintain your dignity and so that no one from outside will disturb you while we're doing the procedure. Now is position the patient in a dorsal recumbent. Will allow a good visualization of the area that is to be performed because embarrassment and chills will make the patient become tense. Now put a waterproof underpad. Put a waterproof pad. And apply a direct light for visualization of the genital area. So this will provide a good visualization when doing the procedure later. Now is open the set and observe a sterile technique. And put on these sterile gloves to prevent contamination and maintain sterility. Okay. Now put on the eye sheet. So using this sterile forceps, cleans the area using a cotton ball with betadine. So a thorough cleansing will prevent contamination, and let's start from the midline to bottom, from symphysis pubis to the anus. And discard. Next is for the labia majora. And starting from the labia majora that is far from me. Okay. And the other side of labia majora near from me. Okay, discard. And next is for the labia minora. Okay, so after cleaning the genital area, we're now going to change our glove because my glove is now contaminated. Now open a new set of sterile gloves. Now is open a new set of sterile gloves to prevent contamination. Now is connect the catheter with a pre-filled syringe. Next is lubricate the catheter for about 1 1/2 inches, being careful not to plug the eye of the catheter. So lubrication reduces friction and prevents urethral trauma, thus reducing pain upon insertion. Now pick up the catheter at least 3 inches from the tip of the thumb and place the thumb and one finger of the left or right hand between the labia minora and separate and pull up gently. So this will provide visibility, and insert the catheter into the meatus for 2 to 3 inches or until the urine begins to flow. And if a specimen is to be collected, pinch the catheter with the thumb and a finger while placing the specimen container in position, so the urine will flow out of the catheter, and if lumen is not occluded. Press the hand in the pubis area while holding the catheter and place in place to prevent pulling and pushing of the catheter. And now is connect the catheter to the urine bag. So that the urine will not leak from the bag and maintain its sterility. Now is inflate the balloon for about 10 to 15 cc of sterile water, and I have here a 10 cc of syringe, and making sure that there will be no leakage of water from the balloon. Now secure the indwelling catheter by tapping it to the patient's thigh. So allow some slack to the tubing to accommodate the patient's movement. Okay, so we're now done, mom, and I'm now going to cover you, but I'm gonna take this pad below you first. And I'm gonna take this. And I'm gonna remove my glove. And I'm gonna cover you, ma'am, so that you will feel comfortable. So after doing the procedure, do the aftercare and record the time of procedure done, amount and color of initial output. So by cleaning the environment, promotes comfort to the client. For the documentation of urinary catheterization, we should always include the date and time of the procedure, the type and size of the catheter use, and I use a two-way Foley catheter, latex silicone. Its size is 14-inch. Also record the amount fluid and use, and I use 10 cc syringe of sterile water and document the character and amount of urine, the reaction and response of the patient, and also include other significant observation. And that's all for the insertion of urinary catheterization.